Primary health care is the care at the entry level, care at the first contact with the health providers. And why it's important is because it is the stage at which we can prevent the escalation of a disease to secondary level or tertiary level. There are a myriad of challenges affecting primary health care, including the provider areas, including the patient provider areas, and those that touches on the transport, and others that touches on the failures of the supply chain. The supply chain is a very important thing because it talks about the upstream and the downstream, and how the producers and their product can reach the ultimate consumer. Yeah, so some of the challenges in supply chain includes unreliability of chain link or the suppliers. It also and that leads to a myriad of other issues. For instance, the stockouts may lead to the patient buying drugs from private sector, and some of those drugs that they get from the private sector are what we call substandard or falsified medicine. And that leads to another problem, which in this case may lead to resistance, or it may also lead to poor health outcome. The African Health and Economic Transformation Initiative it calls for action, walking the talk. Many a times there are a lot of theories that are never backed with concrete plans for action. Haiti is encouraging us to walk the talk. Don't just talk the walk. And so it is also a network that would want to support us to have the maximum benefits to the poor, and working with the sisters from different countries to help leverage and eliminate diseases. Haiti is encouraging us to come up with pragmatic solution that will help save the lives of the poor. For instance, they are encouraging us to walk the talk on matters working with community health volunteers for the outreaches and for the prevention of diseases within the rural areas where is dominated by the poor population. Besides that, it is also encouraging us to use technology in resolving some of the challenges related to supply chain. Finally, it's also encouraging the centralization of supply chain to consolidate and promote strategic purchasing, thereby reducing the cost for the poor.